Dr. Stephen Miller is here this morning with the Hamilton County Health Department. You seem to be feeling in the holiday spirit. I like your sweater.
Well, I am. And what better way to celebrate talking about an infectious illness that gives you vomiting and other things than a beautiful sweater?
We have got people watching. Don't make them turn away just yet.
Certainly.
So he's trying to put on the spirit of the season, but the topic is one that will totally kill it. Y'all are seeing an uptick in the norovirus, right?
It is. For this year and last year, exactly lining up as well is a very large increase in the norovirus. And we're seeing small outbreaks at other schools and boarding schools, as well as retirement institutions. And we need everyone to be on their guard and need to be practicing some safe practices, if you will, to prevent this.
Let me kind of, without being too transparent in what the symptoms are. You don't want them. You don't want to get this illness. But does it mimic the flu in any way?
It does, and some people will think that, but what's characteristic of it over, say, other foodborne or other viral illnesses is that it comes on really quick, usually within about 10 to 12 hours, and it's usually characterized first by the vomiting. Yes.
Okay. You're a medical doctor. I'm not going to tell you that you can't give medical terminology on the air. So don't think I'm that much of a prude. So if you get sick, if all of a sudden this hits you, is the right thing to do to go to see a doctor, or is the right thing to do to give it a minute and assume it might be this norovirus?
That's a good question. It also depends on the individual by individual basis. If you're able to rehydrate up, if you're able to drink things like Gatorade or Pedialyte, things like that, and restore the fluids that you're going to lose, and be able to be in a nice, safe, warm environment, you're probably going to get through this just fine. But if it's a small child, if it's someone with medical illnesses, if they're immunocompromised or very elderly, we really need to keep a close eye, because that's someone that may need some medical attention.
What's the shelf life of this thing? Like once you develop symptoms, how long do you typically have
It's
them?
about 48 to 72 hours, and then it resolves.
Okay, so it seems like last year when this thing went around, people were complaining about being sick like for days and days and days.
It can persist longer in some individuals. It can, that's true.
So it's a virus.
It is a virus.
There's no sense going to the doctor saying, hey, can you give me some medication? They really can't.
No, and while we have some antivirals for certain other pathogens, there's not one for this one. It's just going to have to be time in your immune system.
If you do go to the doctor, are they going to check you for flu first to rule that out?
More than likely they will, and that's a good thing, because that's something that, would go down a different pathway as far as treatment and management.
Okay, are there any people that need to be more concerned than others about getting it? Nobody wants it, but for some people, is it dangerous?
No, but if you do work with small children, if you work in the food industry, you need to be much more on guard on it, especially if it's in your own household. You need to take extra precautions.
We've kind of, we're over the COVID hump, and so most of us don't think about it that much anymore. Maybe one benefit from COVID is that we all got in the habit of washing our hands a lot.
Yeah, it made us so much more mindful, and I think that we're much more acutely aware when someone in the workplace is sick or ill as well.
So is that our number one thing, is to maintain good hygiene?
Really is. The key to this is washing hands, usually for at least 20 seconds when you're going to be around this, or in general, it's a good idea to be washing hands.
Didn't you tell me that if you're somebody who's had it and your 72 hours are gone and you feel a lot better, you're still carrying it,
Unfortunately, for several weeks, as long as a month afterwards, you're still carrying it. You still can be infectious to others, even though you yourself do not feel any of the symptoms. So you still need to be mindful.
So what does that look like besides washing hands? Anything else you have to do?
No, but obviously changing linen, making sure all clothing and anything that you might have been wearing while you were ill would be washed and laundered and things like that.
But no need, here we are at the holiday season, no need to stay away from friends and family.
No, but also things like bleach-based cleaning agents and wipes and things like that for all your surfaces and things like that. And if you do feel like you're coming down with this, be aware if you're the one making the turkey or the ham, you may want to have someone else take that responsibility.
Okay, you mentioned the bleach-based products. Do we need to be a little bit careful about making everything in our lives antibacterial?
I completely agree with that, and that's kind of our tendency these days, is that to completely prevent ourselves. We need to be exposed to some things to build up our own immune system so that we can be strong against these things.
Okay, so kind of give us a play-by-play. I've got a couple of minutes left with you. There are people who every product in their house is an antibacterial product. Not necessary?
You know, unfortunately, that can kind of make these pathogens become more resistant over time and create super pathogens. So we can't live in a bubble. I mean, we live in a beautiful world and we need to experience it around us. But we also need to be mindful that if we shake hands with a number of individuals, if we're using public handrails and things like that, that it's not a bad idea that at some point we need to wash our hands.
Is the Germ-X stuff still a good thing to carry?
I carry it, but I don't use it nearly as much as I did when COVID was more prevalent.
But if you can't, you know, like you mentioned the subway railing, you're
Sure.
not going to go wash your hands.
It's better than nothing. No, I agree. It's not a bad idea to keep a bottle of that on
You
you.
mentioned a minute left, you mentioned retirement communities. They often have a sign-in policy. Maybe be careful, use
Sure.
Germ-X after that. Common usage areas, just be mindful of.
Yes, because remember, that's communal living for these individuals. A lot of them are dealing with chronic illnesses, and you certainly don't want to bring something like norovirus into that institution.
Okay, well, you did it. Congratulations. You made an uncomfortable topic cheery and bright with your Christmas sweater. Hopefully you will stay safe and healthy this holiday season, but if you have any needs, you can always go to health.hamiltontn.org. The Hamilton County Health Department has multiple locations across the viewing area to keep you healthy and living your best life.
Thank you.
Good to see you.
Thank you.